April is a critical month for Mozambique as it continues to reel from the effects of cyclone Idai. As for Wednesday, the World Health Organization, in partnership with the Mozambique Health Department, will be embarking on a major vaccination campaign. They're aiming to vaccinate over 900,000 people at risk of contracting cholera. Our reporter Njanji Chauke and cameraman Sicelo Hlanula have just returned from cyclone-hit areas in southern Mozambique.
The Bizu River, a major source of water and transit linking remote villages in southern Mozambique. But on the 14th of March, this river changed from being the lifeline into a source of misery and pain as Cyclone Idai triggered waters, killed people and livestock, flooded homes and destroyed crops. And as the waters began to recede, people who survived after hanging to tree and rooftops narrated harrowing stories of death. In Zimbabwe, search and recovery operations for missing people buried in the mud in Chimanimani are continuing.
And I take this food to supply the people from these homes attacking the waters, because the people killing don't have the food house, don't have nothing.
We took those things here to go to deliver.
Yeah, continue.
To go to deliver, and the people who are suffering from this cyclone.
And almost 3 weeks later, help continues to arrive. NGO Gift of the Givers, one of the first to respond.
We have visited two important rural camps, one in the area and this one here in Matadara, which practically they didn't have any medical response on time. We're busy at the moment trying to move to another area where there's no doctors have been there.
But the death toll could still rise as waterborne diseases spiral out of control.
The biggest challenges from day one was communications and access. There were places that we only be able to do it through the air, and weather was still bad. So in order for us to do surveillance and make sure we have a full picture of affected areas, we had to go around a big area that it's more than 3,000 square kilometers of area. So, but by now we have full understanding of people where they are. Obviously there's still work to be done. We keep on searching, but most of the ground is covered by our teams in order to have a proper logistic assistance plan for the next weeks.
The international community, African governments, NGOs and businesses are assisting.
Well, we learned lessons even in 2000, and the lessons we learned are those where we can protect lives. We're here, we protected lives, and if we were not here to assist and protect lives and the rest of the other defense forces around the subcontinent, we would have lost more lives. There is still water now, and I don't know how those people survive.
At the weekend, a high-powered South African delegation descended on Mozambique to hand over donations.
I think what we should keep on doing is there's a lot of good work that's been done by many business people and many foundations like us in Africa and in other parts of the world. And I can't agree more with you. We have to continue to create the awareness that in the first instance, we as business on the continent, when there are challenges of this nature, we have to take the lead.
But a major task still lies ahead, as 900,000 people are due to be vaccinated for cholera.
There are a number of cholera treatment centres being set up around the province. 9 centres are in the process of being set up or are already operational. There is a vaccination campaign which will start next week. We have 900,000 doses of oral cholera vaccine, which are coming in on Monday, and we will start a vaccination campaign as soon as possible next week. The Ministry of Health are planning to start this on Wednesday.
Meanwhile, Gift of the Givers humanitarian mission to Mozambique drew to a close on Friday.
The biggest challenge is the absence of network. No communication. You can't talk to your people. When you're in South Africa, you can't call them here. When they're in the field, you can't get to them in the field. You pray, hope they find everywhere where they go. You don't know if they have any difficulty. You don't know if they need food to eat. It's very, very complicated. But thank God, the teams we used are teams who've done this many, many times over. They know how to raise to the challenge. Of course, the other big challenge, there were not enough helicopters. Only 2 SANDF helicopters to do so many things. Thirdly, to get supplies across, to put medical teams into islands where help is required. Again, you're stranded because there's no helicopters. But step by step, we started overcoming all those issues.
For now, the most urgent task is to save more lives. Their country may have been ravaged by one of the worst disasters in the southern hemisphere, but these Mozambicans remain hopeful that things will get better soon. For these aspiring soccer stars, life has to return to normal, refining their soccer skills in the hope that one day they will represent their country internationally or play for top teams in Africa. Njanji Chauke, SABC News, Mozambique.